Okay, so Jane Smith is a 10-year-old girl. She was referred by her psychologist, Dr. Jones, to take the Wisc for assessment. She was struggling in school academically, and they wanted to see what the problem was. So her test results showed that she is pretty much average in everything. She's average when it comes to cognitive ability, and she has actually verbal skills are actually slightly above average, and non-verbal reasoning skills were average. But there's one area where she's actually struggling and she's a little bit below average, and that's her working memory. Now, working memory refers to the memory that a child uses while they're actively doing another activity. So Jane is having difficulty with her working memory, which may cause it to be very difficult for her to concentrate in class, and to focus properly. It's important to keep in mind that Jane comes from a affluent family. Their family has very high standards for her, and she may feel extra pressure on her to achieve. And also, there's one of her parents just recently lost a job, and it's making a lot of pressure in the household. So Jane might be suffering a little bit from that. I would recommend that based on Jane's situation, she's pretty much she has strengths, her verbal strengths. She just needs some help with her working memory. So it might be a good idea to give her some assignments that will improve that working memory, such as we go and help her work with her to memorize information, and we could use certain types of skills such as chunking that we could incorporate in her daily routines, so that she learns how to break down tasks of memory. And we should also encourage her family to support her and really look at the effort that Jane's putting into her work rather than focusing so much on her academic achievement. And whatever Jane does should be complimented, and she should be supported and felt unconditional love.